Hi, my dear patients. I am filming myself going through your post-operative instruction sheet so you know why I think it's important that you do this. And I know many of you have already misplaced this very important document, and I want you to have it online. So we're going to go through it. So excuse me for reading, but I don't have it memorized, but we will do our best. Okay, so post-surgical care. It says no drinking through a straw and no spitting until the next day for 24 hours. The reason for this is when you use suction either in or out, it can disrupt the little tiny blood clots that form along the extraction site or the surgical incision line, and it will cause you to bleed longer than normal. So it's very, very important that you not do these things. It is important that number 2, you take all prescribed medications as directed, unless I tell you to do differently. So if you take a blood pressure medication, you do not want to skip your prescribed blood pressure medication. This will cause your blood pressure to increase, and it will then result in bleeding. Or say that you take a thyroid medication or any other kinds of medications that are prescribed by your physician. Really and truly, there are very few exceptions to the rule that you would stop taking prescribed medications. One of the most important exceptions to the rule of prescribed medication is blood thinners. And you and I should have had a discussion before you need post-op instructions about blood thinners. So when you resume blood thinners must be discussed. Swelling. Now, it's very normal to have post-operative swelling, and swelling is generally greatest after 48 hours. So the first day of your procedure, the day you have the procedure done, icing your face will help prevent swelling. But it's important that you don't just hold the ice on the face and never remove it. So we like using gel packs that you freeze or washcloths that you freeze in a Ziploc bag because those things come out of the freezer cold. You put them on the face, they will stay cold for about 25 or 30 minutes, and then they get hot. Your face will then start to have normal blood circulation, which is important, and then you can resume another ice pack after your face has come back to normal temperature and you've had some blood circulate to the area. So yes, ice the first 24 hours, but not continuously. I have had patients actually use too much ice in the past. Now, the thing about the second day, when you wake up the day after surgery and you're swollen, ice isn't gonna really help you. That's when you have to switch to heat, but the heat needs to be warm and moist to penetrate the tissue. And so you want to use either a pack that you can put in the microwave or like a heating pad with a wet washcloth in between it and the heating pad. Just make sure the heating pad is insulated and meant to be used with moisture. We don't want anybody to get shocked. All right. Now, if you've had a surgical procedure, it's likely that you have sutures. Sometimes the sutures will dissolve and fall out on their own, and sometimes they are meant to stay in. You will generally be told which type you have. You can even have them in combination, some of both. Dissolvable sutures generally will start to fall out on the early end about day 3 to 5, and sometimes patients will come back at 2 weeks and still have dissolvable sutures in. I cannot tell you when they will fall out. All I can tell you is they should last at least 3 days. So if you start to lose your sutures before the first 3 days, I do want you to give us a call. If the sutures are still there when you come back for your post-op at 10 to 14 days, then we will remove them. I promise we can put some topical anesthetic on and it should not be uncomfortable. Now, your diet. This is a big question. None of us like to starve. The first 24 hours, it really is best that you have a very soft, almost liquid diet. And this is just so you don't disrupt those little tiny blood clots I talked about earlier. Now, after the first 24 hours, on this form, it talks about a soft diet. And on our website, we're gonna have a little link that will talk to you about what a soft diet is. Now, before your surgery, there is a great book that's for sale on places like Amazon. It's called the I Can't Chew Cookbook. And so it's full of recipes of things that you can eat when it's difficult to chew. So look up that book on Amazon called I Can't Chew, and it'll help you. But just keep in mind that it needs to be soft, and if it hurts to chew, probably not a good idea to chew it, all right? Number 7, it talks about rinsing your mouth. Now remember, you're not gonna rinse your mouth until the first 24 hours has elapsed. There are a few things that are safe for you to rinse with, and there are a lot of things that patients put in their mouths that they shouldn't be putting in their mouths after procedures. The only thing that you should be rinsing your mouth with after your procedure is warm salt water or a rinse that we have dispensed to you and told you it's okay to rinse with. Other than that, I do not want you using any home remedies like hydrogen peroxide or tea tree oil or coconut oil or a variety of other things that you can find on the internet. These things can cause harm and disruption to your healing and actually compromise the results of your procedure. We do have some prescription mouth rinses, either dispensed through the office or a prescription given, and you will need to follow the directions on those very carefully for those to work appropriately. And the important thing to know is if we tell you to use a prescription mouth rinse twice a day, using it 4 times a day does not make it better. Prescriptions and prescribed medications are meant to be taken as prescribed. And when you alter that, you do run a risk of having a bad outcome, even with a mouth rinse. So don't do it. It's very important that you don't brush your teeth. And this is probably the hardest thing and the thing my patients complain about most when they come back to me. Unfortunately, if you brush your teeth and you brush over your sutures and your incision lines, you can cause damage. Now, the exception is you can brush your tongue. And amazingly, if you brush your tongue, it does make your mouth feel very, very clean. There also are commercially available tongue scrapers. And I'm going to do a little video on a tongue scraper so you know how to use it. So that will also be on the website, and you can click on how to use a tongue scraper. All right? Now, also very important, if you have any questions, you may reach me at 210-269-6498. Also, many times my amazing team members, my surgical assistants will have also given you their contact information for you to contact them. So please do not hesitate to give us a call. You are more than welcome to disturb me any time of the day or weekend. Please do not come back and tell me you had a problem and you didn't call. Give me a call. Bye.